This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right. Well, good morning. So I'd say we probably see this, every day, sometimes several times a day. We have a trauma patient coming in by EMS. They're not super sick. They're not particularly hypoxic, but they come in on a non-rebreather mask just for extra oxygen. Is that necessary? Is it harmful? I'd say that a lot of patients get extra oxygen, and the benefits or harms of oxygen have been studied in a lot of different groups, MIs, post-cardiac arrest. There's a kind of ongoing question of how much oxygen is good and how much oxygen is too much and harmful. So this was a study that tried to answer the question of, should you give trauma patients lots of oxygen or not? And it was a large, multicenter, randomized international trial that randomized trauma patients as soon as possible, whether in the EMS setting or in the emergency department, to get restrictive oxygen, so only to get enough to not be hypoxic, or to get lots of oxygen. Everyone gets 12 to 15 liters. And what they looked at was the rates of death, or what they called major respiratory complications, at 30 days. And they wanted to see if there was a difference in whether you got a lot of oxygen or not. And overall, there was actually no difference between the two groups. It was about 16% death or major respiratory complications in either group. There's another trial going on to kind of get maybe more clarification on it. But what I take from this is that there's probably not a lot of benefit to every trauma patient getting lots of oxygen. Is there clear harm? Not necessarily. So if someone's short of breath, if you don't know what's going on, it's probably not harmful. But if someone, is just a trauma patient, not having respiratory symptoms, they're not hypoxic, they probably don't need a non-rebreather just because. Any questions or comments? All right. Thanks, everybody.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.